This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch. And a word of caution, if you're headed out this morning, it is cold. I mean, it is freezing.
Hey, it's springtime, John.
Oh,
it's in your head.
Right. Yeah,
it's in our heads,
okay.
Right? Yeah.
Okay.
Yeah.
When
Wow.
you go out, just remember it's in your head.
Right.
Welcome to another edition of Health Watch. Every Sunday we're here, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as always here on Health Watch, we talk about the who, what, when, where, why, and how of Innovative Medical Associates, how they can help you and your family improve your overall quality of life, and anything else that you want to talk about, we are here. 855-839-1210, 855-839-1210. That's the number here in the studio. Before we get started, we want to say a shout-out to, what is it?
John at Jersey Doors, because it's a very interesting thing, John. You know, you got to laugh. You say to yourself, you never know who's listening to your shows, yours or our joint show here. Yeah. It was like unbelievable. He goes, when he heard me on the phone, because I had called because we had a problem with glass that we needed to be replaced. And this gentleman is familiar with the glass we were using in the building. And so when I got on the phone, he goes, "Are you that Dr. Molly with the wonderful John?" I said, "I am." And I said, "So of course I guess this is going to cost more." And he laughed. I laughed. I said, "But I got to give him a shout out because they were so attentive to us." So that's number one. The other thing is I get calls throughout the day. You know, I have some problems. I have patients in from out of town, and they forgot to take a medication with them, or actually a supplement with them that they need, and they really need it. So who's going to help? One of my wonderful patients who's been volunteering with us to be a driver, Tim. He's on his way to the office to get the thing, to drop it off to the hotel for these people. I can tell you that people in our office, meaning not just my staff, but other patients, they are really kind-hearted and great people. They really want to help other folks, and that's why I love doing this kind of medicine. And
we should mention that you don't go to sleep.
Well,
because,
no. Well, this
was
was a weekend that I can say was very interesting.
A couple of calls at 1 a.m.
Yeah, well, you know what? That's our job, yeah. Right? That's what I say. It's our job, John.
So, that's part of what you do.
Yes.
What is it that you do on a regular basis?
Well, on a regular basis, we actually are a group of like-minded healthcare providers who all operate out of my primary care facility, which means our physicians, and we have two, and by the way, I disturbed them this weekend too, and they picked up. Okay, so the question is, we really try our best to help people by utilizing natural substances through the utilization of the hydration therapy to actually affect a change in their medical condition by reducing the amount of pharmaceuticals that they are using, and thereby reducing some side effects.
And the side effects are many.
Oh, yeah.
With pharmaceuticals.
Oh, yeah. Right now, yeah. I mean, I would say, look, you can have side effects with natural substances. We hear that all the time. But they tend to be not as severe as the kind of side effects you see, especially right now with all these designer drugs, John. It's amazing. You know, look at the inside of your prescription. It's unreal, right?
Yes. Yeah. And the other thing, we always talk about this, the commercials on TV.
Yeah, they're scary.
The first 15 seconds is about the drug, and
right.
Then the second 15
and death
and death. And then death. Oh, by the way, you could die.
Yeah.
Okay.
I know. It's really look. I'm a chemist, right? So I believe in biochemistry. So a lot of good things have come out. The question is, utilizing them properly, making sure you understand your doctor's directions, and then seeing if there's some way you can effectuate the change by utilizing some of the things we do at our facility.
You've had a lot of success in what you do.
Yeah.
And it's to your credit. And
well,
you're very
it's to
humble.
the staff, everything.
You're very humble. You won't say that. But what do you attribute that to?
Well, I attribute it to the great physician. We're in the Holy Week, and I think that he's been very helpful. And he has given us a lot of natural ingredients to help us along our healing journey. And I think from the beginning of the Garden of Eden, some of these things existed. It's a question of how to use them, the synergy of using them with the drugs that are out there right now. And I think my staff is just phenomenal.
Your protocols
are unique. Those two. Yeah, they are.
And you have over 600 of them.
Variations, sure, because you use certain natural substances together in synergy, and you put them together to effectuate the change you're looking to do. And more importantly, what I have found, at least in terms of people coming through our facility, is many, many people are what? Dehydrated. They have nutritional deficiencies that'll knock your block off, meaning even though they're eating well, even though just the way we live today, John, the stress levels that we have, we find that the body is completely assaulted on a daily basis. And hence, that is what drives people to us.
When you sign up a person and they start with you, what can they expect? Because I know you manage expectations.
Well, I try to. Because, look, I tell you all the time, it's not holy water, right? And that it isn't. But if you come in, I am seeing a rise in autoimmune, in cancer-related conditions, cardiac conditions, and of course, diabetes. So what I try to do during the free consult is get a handle on a particular patient's problem. And I want to look at that patient as an individual and see I want to know, are they coming for one thing because they don't realize they have comorbidities that are contributing to the thing that drove them to me? Most times I find that is true. But many times they just don't understand that inflammation, and we're going to talk about that in depth today, but inflammation is the culprit. And they really need to look at this both in their lifestyle. We try to help them with their lifestyle, but fundamentally, we got to get them in the chair, as I like to say.
How many treatments would it be to effectuate change?
Well, I would say people start to feel better in as little as 5 weeks. Some people can't get there until 10 to 15 weeks. But I would say somewhere between 5 and 15 weeks, people start to notice the difference, whether it's the pain levels have decreased, whether they find that they're having more stamina, whether we see that the actual quantitative data, meaning the blood work, etc., has improved. All of those things we can usually see within the first 15 weeks.
And within the first 15 weeks, they see the change.
Yeah.
Do they continue at that point?
Sure. I mean, here's the thing, John. More than ever, when I discuss what we're going to discuss in the next segment, we're going to see that there are so many things assaulting us, meaning whether it's toxins, whether it's just our lifestyle, stress. Just living today is causing stress. So what happens is the body is always moving in a state of imbalance. And that's really what I try to help people with. Bring us back to homeostasis as it relates to the individual. Look, we're born in perfection for the most part, right? We're born little babies, and for the most of us, thank God, we're 100% together, unless we have genetic issues, those kinds of things. But it seems that as we are exposed to everything in this world, man, we become middle-aged. It's like people fall apart, right?
Yeah. You were talking about side effects.
Yes.
Are there side effects
to
natural substances?
Well, you can, but in 27 years, and Linda will correct me if she thinks it's 28, but in 27 years, we've seen very little side effects. We've seen some low blood sugars that occur, in which case we do have crackers, etc., for people while they're there. Obviously, before I put you in the chair, I ask, are you allergic to anything? Because that gives me an understanding of what type of powders I need to use or not use. And many times, for the most part, by the time people get to me, they're they really have an understanding of what kinds of things can cause them some challenges. So we've never had any problems.
And so there is very little side
right,
effects.
if you use the right stuff.
On the other side...
Well, there's a lot more in terms of the pharmaceuticals. And the other thing is that I would say is people think they're allergic to a particular substance in some pills that they're getting. Most times that's not the case. It may not be the main substance that's giving you a problem. It's all the fillers and things that are in there.
And there are a lot of fillers.
Oh, man, if you don't get a good nutraceutical, forget about it.
And you do give advice on nutraceuticals.
Oh, absolutely. And listen, come on in. We I have a nurse who'll knock your socks off about that.
Oh, I know about that.
Yes, I know.
Yes.
I know.
And if you don't get the right thing,
forget about it, as they say. Forget about it.
Forget about it. But we are coming up on our first break of the morning. Our show is called Health Watch, and we're here every Sunday, 8 till 9 on Talk Radio 1210. WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. Do you have a question for Dr. Molly, or you have a medical challenge that you want to run by her? Very simple. You can call here in the studio right now. We're live, 855-839-1210. That's the number, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I will return. We're both coming back with more Health Watch right after these words. We are back here on Health Watch, and as always, operators are standing by right now at Innovative Medical Associates, 856-489-0505. And when you call, the thing that you want to do most is make the appointment for the initial consultation with Dr. Molly. And it is complimentary. That's all you got to do is make the appointment. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com. That's the website. This is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. We are going to the phones right now. We're going to talk to Sharon in Deptford, New Jersey. Sharon, good morning.
Good morning,
You're
Sharon.
on Health Watch
Morning.
with Dr. Molly.
Hey.
Yes, hi.
Hi.
Hi, I had questions, if I may, please, for with drug addiction.
Oh, yeah.
I saw that it was you do something with opiates. However,
Yes.
if someone is addicted to the opiates, but also a doctor has been prescribing benzodiazepines for years for this person.
I know.
That's a quandary. I recently found something called low dose, and I'm sorry, I can't pronounce this.
Low dose naltrexone. Low dose naltrexone. Yes.
No, I know
Okay.
about that.
Okay.
It's SLUMAVENIL.
Mm-hmm. Okay. Talk to me about it.
for-
I'm not sure.
I found something about it for benzo withdrawal because he's going hopefully to a faith-based program. It'll be about a year, but they do not taper off of drugs. So the need is to get him off of the opiates and the benzos before he goes. And
Absolutely.
I know that's a very hard thing.
Are you a nurse by any chance, Sharon? You're a nurse?
No, I am not.
Well,
No.
you sound like one, so you should be one. You're actually, I don't know who you know who has this problem, but you're really trying to help them, and I applaud that. I really do. Yeah, got to do the research. Yes, we detox people from both the opioids and the benzoids. The benzoids, of course, are more difficult. You're always in that catch-22. We have an IV detox therapy that tends to work. When you talk about tapering the dose, there are ways to taper the dose of the benzoid to help the patient while going through this. But again, we use NAD and a few other things. I mean, there's really some bona fide data out there to show that the NAD can help in this case, and so can the use of low-dose naltrexone when you're here. I'm not quite familiar because you're spelling it for me, but I didn't write it down, and I'd like to write that down. So if you call my office, I would love you to tell me about this particular product you're talking about.
Mm-hmm.
I would
say you might. Oh, I'm sorry. I apologize.
Go ahead. No, I'm sorry, Sharon.
I would think it would be pronounced Flumazenil.
Sumazenil.
Yeah, that's the way it looks like it might be pronounced.
And is that a brand name that you're looking at?
I'm not quite sure, to be honest with you. I think surprised to come up with this article. Yeah. I've never seen this before, and it is intravenous infusion.
Oh, yeah. Okay. All right. So I wouldn't be surprised if that isn't the brand name for a particular type of product that they use the NAD in. But I would like to look at that and see where we're at. But this sounds very interesting. We definitely do this. It is not, let me say this, it's not a quick process, my friend, no matter how you do it, because those benzoids are rough, very, very rough to get out of the system. And you got to be real careful. I'm lucky enough to have an anesthesiologist as my medical director, which is helpful in cases like this because it is a mess. God bless you, and I'm glad I'm glad the person's going to a faith-based facility after the fact because they're going to need it. God bless you. Thank you.
Yeah, okay. And make sure you call Dr. Molly.
Yeah, just leave it with my gal on the phone today. Okay, sure. I want to really look into that, and then maybe we can chat. Leave a phone number. We can chat about it.
Thanks for the call, Sharon.
Thank you.
We appreciate it.
That was a great call, and I don't really talk much about utilizing what we do for the detox program. I'm talking about the opioids and the benzoids and that kind of thing. But it's much more common than people know. I see a lot of elderly people who are addicted to the benzoids, right? And getting them off of those are insanely difficult, and you really have to work at this over a long period of time.
I remember the most famous case you had.
Oh, I know.
Where you detoxed a patient.
Yeah, I know.
And it took you, I remember a couple of your nurses slept there.
That's right. That's right.
But it was a while ago. It was like 10 years ago.
That's right. But we've done several since then.
You've done, yes.
Yeah.
It's a process.
It's a process, and we've got to be fully present with the patient. It's not, I got to say it right out, it's an expensive process because, again, like you said, the gals are staying with them 12, 15 hours. We're not, they got to be tied to me. Okay, forget about me. They got to be tied to me and in real quick action to my doc. But it can be done, but it is difficult. It's difficult, John.
All right, 855-839-1210. That's our number here in the studio. If you have a medical challenge you want to run by Dr. Molly, or you have a question, 855-839-1210. That's the number. We're going to talk about inflammation. One of your favorite subjects.
Inflammation. Here's the thing. Most people, when we think about inflammation, at least when they come in to see me, they come in with the problem of pain. They have pain. They may have pain in the joints. They have pain in the muscles. They have pain. And in saying that, of course, they forget that, the pain sensation really can start on the spinal cord where the nerves are and in the brain. So one of the ways I look at chronic inflammation over the years that people have, whether it impacts the liver, the lungs significantly, or it impacts their muscles or joints, etc., I look at treating some of the brain inflammation. And again, this is a different viewpoint than, let's say, conventional because, when they think of inflammation in the brain, they're thinking of certain brain diseases like certain encephalitis, these kinds of things, right? That's truly, in their mind, brain inflammation. I'm looking at it when we do it as the chronic pain that is released from maybe short-term inflammation that went out of whack, and that's the key because inflammation is a good thing, right? I talk about that.
Yes, you do.
When it works, it's great. But when it goes out of control, wow, we got big problems. And neuroinflammation is the response to the inflammatory challenge, regardless of where it is. In other words, if you have pain in your joints, in your small joints or your large joints, or you have pain in the muscles, or you broke your arm like I did, or whatever, guess what? It all begins with the pain sensation that the brain sends out the chemicals, right? And says, you got pain, we need to send them. What the real problem happens is when the chemicals start to cascade the inflammation process, and you can't get that under control, John.
A lot of people buy supplements for the inflammation. Talk about...
For all inflammation.
Right. It's probably not the best thing to do.
Well, it's not a bad thing to do, but the problem is, how do you get to the proper therapeutic dose? We all know that there are many, most of our patients are so intelligent, right? And most of our listeners are so intelligent. We've heard all about curcumin. We've heard all about frankincense. We've heard about these things. So why aren't they working for you? There's the question. Like, why isn't that working? You go out and you buy this supplement. Right now, our TV and radio is inundated with supplements to help you with chronic pain, right? But why didn't that one work for you? Well, there's many reasons. One of the things is the use of these supplements in a vacuum. By that I mean, are you using supplements that are that can work together and are strategic in working together? For example, you might want to use curcumin. I love that because curcumin has a true therapeutic value. It's the constituent in curcumin that actually helps. It inhibits the NF-kappa B enzyme system. Now, let me tell you something. A lot of the drugs don't even look at that. They're always looking at the system that everybody's heard of, the COX-2 inhibitors and all of that stuff. So sometimes they're only looking at one particular challenge, meaning one particular thing that can cause the inflammation or stop the inflammation. When I look at pain, whether it's systemic, like it's joint pain, etc., I'm looking at putting together the mixture that's going to work on all of these enzymes, not on just one. So, for example, we use curcumin, but we also use frankincense, boswellic acid, right?
Yes.
Okay, in the same thing. We may use curcumin, which is a bioflavin, and we extract it from onion. And why do we use it? Because we know that it goes after the free radicals, which are very, very bad. They're unstable. They do damage. They are unbelievable. And the other thing is, sometimes these same supplements, whether we're using it for the neuro or whether we're using it for joint pain and bone pain, this kind of thing, you've got to use it correctly, right dosing. I'm talking about through the hydration. We use all of this in our hydration protocols. Why? It's a direct hit. You're going to get the full effect of the particular constituent in the particular product,
as opposed to
taking 10 of these
pills,
right. So this is a big issue, and using them correctly together. For example, people know one thing this past 2 weeks, somebody comes in and says, hey, I know that pineapple, right, absolutely will help my stiffness and all of this, my stiff neck, whatever. Well, okay, pineapple has bromelain in it. Okay, that is the constituent. And by the way, a side note, folks, Dole did the research in the bromelain back in the 50s. Okay, is that cool?
Yeah.
Right? Natural, all right? But what does it do? It helps break up scar tissue. That's a different problem when you have scar tissue, right? But what do we do differently with the bromelain? Well, I'll tell you. We look at improving blood flow to the area that has the problem, because that's going to give you some of the additional nutrients that we're working on. That's actually going to intensify the bromelain.
Well, that's a good point to kind of say we're going to take a break.
Okay.
And we're at the halfway point of the show. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210. That's the number here in the studio. If you have a question for Dr. Molly, or if you have a medical challenge you want to run by her, feel free to call in 855-839-1210. Dr. Molly and I return. More of today's Health Watch right after these words. We are back here on Health Watch. 856-489-0505 is the number for Innovative Medical Associates. And operators are standing by right now, and they will be there well after we leave you at 9 o'clock. So, look, they're not taking off Sundays. 856-489-0505 is the number. And if you want to check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Check it out. It's a lot of good stuff on there as well. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. The number here in the studio, 855-839-1210. We're going to talk about some pain relief and other things related to inflammation.
Well, what I want to say, John, is that, I did a little research. Everybody goes immediately to the over-the-counter pain relievers, right? And I did a little research, and there's a lot of articles on PubMed that show that these over-the-counter pains, they work, okay? They stop that. They stop the signal. They do block some of the signaling, which is a pathway, from reaching your brain, which is why so many people use it. But they also can raise your chance of serious heart problems by 50% for some people. It's my opinion that these particular drugs, although they are good in the short term, you don't want to stay on them a long time. You want to look at some of the things I spoke about earlier, which means looking at the boswellia, the quercetin, the bromelain, and of course, one of my favorites, magnesium. But they got to do what? They've got to be, if you take them orally, they've got to get past the guards in your digestive tract to get up to where you need the pain relief. And that is a mighty task. That is why hydration therapy with this particular type of challenge works and works fairly quickly. We talked earlier about when do people start to feel relief. I've had people who've had chronic pain who've come into us. They start to feel better in 4 weeks. I have. And one of the reasons is because utilizing the synergies of certain numbers of these products along with other things. I don't just use what we spoke about earlier. There are other things I may want to put in their bag, so to speak, and in their recipe, depending on what I'm trying to accomplish and where the pain is. But ultimately, the bottom line is when you take these over-the-counter things for a very long time, they can actually make your pain worse. So it's blocking signaling for a while in the brain, but not really. It can make it worse.
You mentioned you shouldn't be on these drugs a long time.
Yeah.
How long?
Well, there's no hard and fast rule. I mean, Bayer wouldn't like me talking about it. But the bottom line is there's no hard and fast rule. But the point is what you want to do is you want to effectuate the change that you need in a way that your quality of life isn't impeded. One of the other things I've noticed, liver functions get disturbed with some of these products. Some others rip up your stomach using them. So, there are so many issues with those products. If you use them more than a couple of times a month, you may end up with other issues. And so, are you helping your pain? Well, maybe in the moment you are, but not really. And that's what I'm saying. And if we use these particular products like the anti-inflammatories that I spoke about earlier, we're actually using them in a way where synergistically they work together. And you then can get some real relief because one product may intensify another. And the idea is you got to know which products to use, right, for a particular thing, because sometimes you then can also cause the reverse effect where you give one particular product with something else and it's not working.
So the bottom line is hydration is probably the best cure for this?
I won't say cure, but it will certainly hold down your pain levels. And the idea is, in addition to that, I'm always looking to do what? Improve the blood flow to whichever areas are truly affected, because one of the ways to restore the health to your connective tissue and to organs, all your organs, is what? Improve your blood flow, utilizing these nutritional supplements in a way that they're going to actually improve your quality of life over time. So it's not enough. Yes, in the short haul, you want to address the pain, but what you want to do is improve your quality of life over the lifetime.
And, you talked about blood flow way back when. You
Unbelievable.
cut your teeth
on chelation.
Chelation.
And
that increased the blood
at
flow.
At 12% head to toe. And I will tell you, even today, chelation has to play a part in the inflammation protocols that we use, because we know that when you increase blood flow and utilize the proper nutraceuticals, you not only get the relief, but you may be able to sustain it over a longer period.
And, that's the thing, that this hydration really has a lot of benefits
Absolutely.
that you don't think about.
Absolutely. Just this week, one of my patients, when they came up, one of the out-of-town patients, she was so depleted nutritionally that there was no way we could even address the underlying issues that I know are there, which happens to be bacterial infection, until we got her nutritionally able to take the antibiotics that she needs to effectuate the change she needs. We have to look at this. And I will tell you, I'm seeing more and more people in a state of dehydration. And I spoke to a doctor who's a friend of the clinic, and he said the same thing. He said people don't even know how dehydrated they are today.
And you've had a few patients this week that have really been in trouble.
Yeah, absolutely. Absolutely. Another good thing about what we use, we might use green tea extract. Okay, using the green tea extract, people say, "Well, I'm going to drink a lot of green tea, and that's going to help it." There's a supplement out that has green tea in it, and you make the tea. Okay, that's great. Not really, because you're still not going to get the level of the green tea you need, the active ingredient in the green tea, to effectuate the change. Caffeine has a use. Not too much, though. Goldilocks theory. Too much caffeine is not good for you. Too little is also not going to effectuate your change. So there are many things to take into consideration when we talk about inflammation. And we can't box inflammation and say, oh, well, I'm only inflamed in my knees. I'm only inflamed in my hips. I'm only inflamed in my elbows or my small joints. No, you probably have systemic inflammation that starts with the brain signaling.
So you've got inflammation
probably
much
everywhere.
Yes.
Probably everywhere. And you're walking around and you just don't know it. In fact,
right.
You're probably walking around in brain fog and don't know it, which is another form of inflammation. So I urge everybody to look at neuroinflammation and see how that's linked to brain function and the overall pain signaling that is happening. And chronic pain wears you down. You know it. We all know that. And I'm seeing a lot of people who have chronic pain, and that's something I focus on when you come in.
We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge for Dr. Molly. 855-839-1210 is the number here in the studio. 855-839-1210. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch. Operators standing by at Innovative Medical Associates. 856-489-0505. That's the number. And when you call, very simple. You want to set up the initial consultation with Dr. Molly, and you can find out a lot about what she can do for you and how maybe she can help you and improve your quality of life. 856-489-0505. 0505. That's the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. You can call now. You can call after we leave you at 9 o'clock, but they're there all day. Operators are standing by, 856-489-0505. This is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to go to the phones and we'll talk to Judy in Orland, PA. Judy,
hey,
good
Judy.
Morning. Welcome to Health Watch with Dr. Molly.
Hi, Judy.
Hi, good morning, guys.
Yeah,
I just had a question.
Sure.
I was recently at the dentist, and they're talking about my gums receding and some gum disease, and I had read about
Go ahead.
probiotics helping that.
Yes, I think that's a good idea. As a matter of fact, Dr. Molly was just at the dentist this week, too. And, the dentist and I were having a nice talk about gum disease. I don't know how old you are, Judy. You want to tell us? Tell me how old you are, my dear.
65.
You're a baby.
Oh,
Listen to me.
geez.
Dr. Molly's going to be 76 in a couple of days. Oh, well, maybe a couple of weeks.
Couple weeks. Yeah.
So, but you know what? My dentist said to me, how do you keep your gums so well? I said, well, probiotics, and I also gave him a little tip. I said, coenzyme Q10. All right.
Oh, really? Okay.
Yeah, go pick that up, and I will tell you, it's really good, and see how well you do. And the other thing, the most important thing, and you know what, Judy, I discount that all the time. Dentists, there are a lot of holistic dentists today who really understand that you've got to maintain and keep the inflammation down in your gums. That's another area where bacteria really assaults us, and then it goes down to systemically, and believe me, it's a bite, as they say. Truly, it's a bite, and you want to make sure you're on it. So definitely, I don't know what probiotics he recommended, but there are several good brands out there. Look around and utilize one or two of these a day, and I think you're going to be in a lot better shape. Okay?
Well, thank you so much.
God bless
Thank you, Judy.
God
Good
bless.
luck
That
with
was a
that.
nice little question because people forget about dental.
We have Frank in the Northeast.
Oh, good.
Frank.
Hey, Frank, we've been talking you up. How are you?
Hey, Dr. Molly, I'm keeping John on his toes by calling the last couple minutes.
Good. You're okay. That's right.
He
That's
loves the last
good.
minute callers. Now, I was upstairs stretching. There's no phone upstairs. I had to call you because I heard that lady. I'm not sure if it's a friend or a family member. They're trying to go to rehab.
Yeah.
I just want to let her know I just celebrated 4 years on March 21st. And my problem is booze. Doesn't matter. Drugs,
you're
booze,
right. That's
gambling.
right. That's
They're all-
right.
But I tried for years, decades
Right.
actually. But faith-based programs are a way to go.
I
they
agree
have a
with
90%, They have a 90% success rate after 5 years. 90%. Regular rehabs are 5 to 10% after 6 months.
Hey, Frank, you know what's so interesting that you say that? As you know, listen, I'm a big believer when we need to go into this kind of thing, and you can't, yes, we can physiologically get the patient off of things like the Xanax, et cetera, all of those drugs, as well as the opioids. But in the end, what has to happen? You got to change that mindset. You've got to find a way to do it, right?
Hey, Dr.
No
Molly,
matter what.
I'm glad you said that because I was going to bring it up. Excuse me, the allergies are killing me today. A friend of mine, Captain Lou, he's also from South Philly, your neck of the woods. Mm-hmm. He never gave up on me. This was going back when I was a cop back in the 90s. He wanted me to get on rehab again. I said, I'm not doing
Mm-hmm.
it. I've done it before. He said, Frank, okay, fine. It's a disease of the mind, body, and soul. You have to correct all three. He said, this is what I did, Dr. Martin, and it worked. I went to church every day. I exercised every day, and I went to meetings every day.
Good.
I attack the mind, body, and soul. I listen to K-Love Radio. I listen to you
I
and John
do too.
every Sunday.
Hey, K-Love is the only radio station I put on in the clinic. You know that,
That's
okay?
me. No, I didn't know that. I didn't know that.
Yeah, you were there. God bless you.
Well, that lady listening, the faith-based one's the way to go. If you can't do that, just do church every day. I don't care what your faith is, church, or just pray every day.
Right.
Exercise every day, does something to the brain, release the endorphins and everything.
Exactly.
And go to meetings every day. If you don't like meetings, do it for at least a year every day. I did 2 or 3 a day for the first year.
You know what? I really applaud you, and you know how I feel. And you had every reason to be on those particular drugs, given your condition. That's the problem. People get on them, never get off, and then you're stuck. And unfortunately, what happens, the biochemical cycle keeps spinning, and man, we got some trouble. But can we help a patient? Yes, but I definitely believe they have to do the faith-based. I do too. God bless you, Frank.
And that lady listening, my life is not great. Dr. Molly knows I got a ton of medical problems, but being sober, I can handle a lot better. I'd be a lot worse if I was boozing. So good luck to your friend.
And
thanks, Dr. Molly.
And thank you, Frank. And you know, I believe
have a
that.
good holiday,
Hey, Frank, have a wonderful holiday. And everybody out there, I hope they have a good holiday.
We have a couple minutes left. I know you wanted to give us an update on Lester.
Lester was one of my patients who came in, I told you, from Indiana that had the obscure fungus infection, and he's doing exceedingly well. It took quite a while. I mean, he's been here over a month this last time. And I will tell you, we put the chart together, and we have a very well-known infectious disease doctor who was looking at the chart, and my doc knew him personally, but he called the office and he said, hey, you know, you guys did as good a job as any infectious disease person could do. He said, I don't know if there's going to be much for me to add to this. I want to see the patient, because he said, I think we should write this case up. And I was delighted to hear that, because the point is, John, you can go after the condition, but only if the patient is in good enough nutritional status to get him through whatever it is the drugs are that you need to give him. This is true for my cancer patients, my autoimmune patients. If you're not in nutritional shape, you're never going to get through the protocol, the traditional protocol. And you know how I feel. You need to do tradition. When you need it, we've got to do it, whether we implement it or you go elsewhere.
And real quick, the young lady who you...
Oh, man, yeah, she's a piece of work. Yeah, the young lady that we have also. I have another patient that is also has a lung issue that I believe is related to a particular toxin. She used to varnish a lot. But the bottom line is she's so nervous that we can get her pulse ox up to in the 90s. She definitely has rails still. But over the weekend, they were having a little problem. I said, just go right into the emergency room. They went into the emergency room. I met them at the hospital when she got put up to a room. She wasn't in intensive care. She was only there for 2 days. They ran all the tests that we ran. They sent her home on no medication at all. And she's at the hotel, resting comfortably, little anxiety ridden, and I'm going to handle that today. And that's the point. The point is you got to get your head in the game too.
With that, we are going to put the wraps on another edition of Health Watch. Don't forget, if you want to call Dr. Molly, 856-489-0505. That's the number at Innovative Medical Associates, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and the nursing staff, Barbara, Lana, Donna, Vicky, and Daniel, and of course there's Joanne, delightful Dee, fabulous Fran, and our medical assistant Sandra. I'm your host, John DeMasi. Thank you for listening. We will talk to you next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.